Nerve Conduction Study Part 2. Motor Nerve Conduction Study. Motor nerve conduction studies evaluate the functional integrity of motor nerve by stimulating a motor or a mixed nerve and recording the resulting compound muscle action potential from the muscle supplied by that nerve. Recording technique. The ideal muscle for the study is the recording muscle should be well isolated, should have minimal interference from the neighboring muscles, should have reduced volume conduction artifacts. Recording electrodes. A pair of surface electrodes are used for the study. Active electrode, also called G1, it is placed over the belly of the muscle, ideally near motor point or end plate zone. Second electrode is reference electrode, also called G2. It is placed over tendon of the muscle. It is also called indifferent electrode or inactive electrode. This arrangement is called belly tendon recording. Normal compound muscle action potential waveform. Normally, the waveform is biphasic. There is initial negative deflection followed by positive deflection. If there is initial positivity, then you should think of incorrect placement of G1 away from the motor point, or volume conducted potential from the nearby muscles, or anomalous innervation, or accidental stimulation of adjacent nerves. Sites of stimulation. The nerve is stimulated at distal site and one or more proximal sites. The purpose of this is to evaluate different nerve segments and to calculate the conduction velocity. The nerves usually stimulated at just one site because proximal portions of these nerves are inaccessible. Such nerves are axillary nerve, femoral nerve, and facial nerve. Coming to CMAP amplitude, it is defined as measure of the difference between the baseline and the negative peak. It is measured in millivolts. The significance is it represents the number of functioning motor axons conducting between stimulation and the recording site. The amplitude also depends upon synchrony of the axonal conduction, integrity of neuromuscular junction, and number of muscle fibers activated. CMAP duration. It is defined as duration for which the negative phase of CMAP will last. It is measured in milliseconds. It depends upon conduction rate of individual axons and distance between stimulation and the recording site. The physiological temporal dispersion happens because of this. So, with proximal stimulation, the CMAP duration increases and amplitude decreases. This occurs because of fibers conduction are at different speeds. CMAP area. It is defined as area under the negative phase of CMAP waveform measured in millivolts into milliseconds. Latency. It is defined as time from the stimulus artifact to the onset of CMAP. It is measured in milliseconds. It reflects the conduction in the fastest fibers. The two important types of latency are distal latency obtained from distal stimulation, proximal latency obtained from proximal stimulation. It primarily depends on length of the nerve segment and it is minimally dependent on neuromuscular transmission time and muscle fiber propagation time. Conduction velocity. It is the speed of the nerve impulse conduction along the nerve. It is measured in meters per second. The formula is motor conduction velocity equals distance divided by proximal latency minus distal latency, where distance stands for length between the two stimulation sites. In this image, we can see motor nerve conduction study of the median nerve, revealing a typical compound muscle action potential with distal and proximal stimulations. It shows the distal and proximal latencies, CMAP amplitudes, duration, and areas. The proximal CMAP has a lower amplitude and lower area than the distal CMAP because of physiological temporal dispersion and phase cancellation. The proximal conduction velocity is calculated by measuring the distance of the elbow to wrist segment and using the formula. Important concept. Motor conduction velocity measures the conduction of the fastest fibers only because neuromuscular transmission time and muscle propagation time are identical at both the sides and hence cancel out. Multiple segment testing, example for ulnar nerve, helps in different segment evaluation. Example, wrist and below elbow and above elbow and axial. This helps in localizing the focal lesions. Important viva points. CMAP stands for Compound Muscle Action Potential. G1, active electrode on the muscle belly. G2, reference electrode on the tendon. Normal CMAP begins with negativity. Initial positivity suggests wrong electrode placement. Distal latency assesses the fastest fibers. Conduction velocity requires stimulation at 2 points. Proximal stimulation causes slight temporal dispersion. CMAP amplitude reflects functioning motor axons.